All right, we're going to go ahead and get started here. Thank you again for everyone attending today to learn more about the health plan and other benefit offerings through your state Iowa Home Builders Association. With that, we're going to jump in. I want to introduce myself, Chance Oster with Kunkel and Associates. I'm an account executive over at Kunkel. I've been with Kunkel for a little over 4.5 years and specifically work with companies on their group healthcare programs as well as their ancillary lines of coverage, dental, vision, and any other coverages that an employer would offer. Erin Sieverding, she's not on the call with me today. She's a senior benefit manager. She would be your dedicated account manager on if you were to join the program, excuse me, and she would be the person that would be kind of your day-to-day contact to do admin work, enrollment, and things like that. But together we work as a team on your account if you were to join the program. Again, too, I want to mention if you have any questions today, there is a questions box on the list here. Go ahead and throw your questions in there. I'll answer them at the end. Make sure you do the question box. There's a chat box too, but use the question one. So moving on, the Home Builders Association, partnered with Kunkel and Associates a few years ago, understanding that the home building industry, has some unique needs, and the opportunity to put together an association health plan was allowed by the state of Iowa with some new federal guidelines that were released a few summers ago. So we put together an exclusive members only pricing solution from Wellmark for the health and dental, IMED for the vision, and Unum for some additional new coverages that we are rolling out this year. Key features we're going to talk about today and about the plans is the exclusive plan designs with Wellmark, and to see how we can help get you guys some competitive pricing and cost savings. We'll talk about the benefit administration and enrollment. We'll show the dental and vision options as well as our new voluntary coverage options through Unum, and just talk a little bit about our price negotiating power by banding all together as small employers to be one large employer in the marketplace. The eligibility requirements to enter into the program, you need to be a builder or associate member in good standing with the Iowa Home Builders Association. Many of you join local associations that get you a state and national membership as well. Members' business must be domiciled in Iowa and have at least 2 full-time employees, but no more than 50 employees. What this means is that if you're on the lower end, you need to just have at least one common law employee other than the owner or the owner's spouse that enrolls in coverage in order for the owner or the spouse to get coverage. And then we can have no more than 50 full-time employees. Really, we're targeting the small group market specifically. Entry into the plan, it must be a 2-year commitment. What that means is if you were to exit the program, before that 2-year, 2 years goes by, basically you need to go through one renewal year with us. That would result in a penalty and waiting period for reentry. The penalty is 1% of the employer's total group premium for the year, and that would be paid to the association. And really, this is just an agreement between you and the association. The waiting period for reentry would be if you would drop out after 1 year, you'd have to wait 4 years since your inception date to reenter. The reason we have this rule in place is the state of Iowa, forced and required us to put this rule in place to have this program. And really, it's to keep the stability of the program. If we have groups hopping in and out, we'll never be able to build up a larger group. So we really need to keep stability, which is for the insurance carrier and for the pricing to make this program successful. Walking you through the plan options with Wellmark real quick here. Last year we had 3 different plan designs that we rolled out. This year there is 4, and just kind of walking through them briefly. The first one, HBI HSA Plan 1, that's a high deductible plan. You can see the single and family deductible up there. Now, if many of you are aware or not, an HSA plan is a little bit different than like a traditional plan, which we'll get into with the two middle plans. But an HSA plan does not have any co-pays for your office visits to your like primary care physician or specialist, or your ER or RX spending. So, for example, I always use, if you need to go into urgent care or just maybe go see your PCP, it might cost, even with the insurance company's discount with that, clinic or provider, it might cost $140 just to visit and go see that doctor. Well, on like a copay plan or a traditional plan, you might have, like on this HBAI plan 3, you might only have a $25 copay. And then the insurance company's picking up the difference. On these HSA plans, you have to pay that full $140 example, and then you're paying everything up until you meet that deductible, even on your drugs, ER, and everything. So these plans are kind of designed because you can set up, though, the perk is a health savings account on the side, and you can pre-tax fund money into that account out of your check as kind of a rainy day fund for when these funds arise and when these claims happen. So really these programs, I would say, is for people that are looking for more just of catastrophic coverage, and people that don't really use health insurance very much, but they want to protect themselves in case something, catastrophic happens. But they can save money and bring down their taxable income on the side. So walking through the rest of the plans, HBI Plan 2 and Plan 3 are both traditional plans. The Plan 2 just has a higher deductible for single and family, and the copays are a little bit less rich compared to Plan 3. So Plan 3 is kind of the richer traditional plan, more the lowest deductible option we have with the 3 single and the 6 family. And then the copays are a little bit better, $25 for a primary care physician, 75 for specialists. The ER is a little bit better than this plan 2, and then the RX spends, the tiers are a little bit richer on benefit to the member. This HBI plan, HSA plan 4, this is another HSA plan, which is exactly like plan 1, except for our deductibles are lower for the single and family. So probably a little bit more expensive on the premium versus plan 1, but you have less risk out of your less risk to meeting that deductible. The co-insurance on all of them is 80%. Talking about Wellmark and their value adds, if any of you are with Wellmark today, you would recognize some of these services. Nothing different. Doctor on demand allows for 24/7 access to a doctor, via smartphone, tablet, or computer. What this is their online virtual care visits from an urgent care standpoint. If you're on the weekend, don't want to run into the doctor or something, you can just set up a time. I think they respond within like 30 minutes, and you can get on demand with a doctor for acute illnesses, and they can prescribe certain medicines and things like that right over the virtual care. The Be Well 24/7, this is a service that helps members manage ongoing conditions and can help answer medical questions. It's more of I think, a 24/7 hotline and wellness tool. And then these 4 plans that we're offering, you can get them in a PPO and HMO network. And as many of you know, PPO network is going to be a broad, broad access to many different hospitals and clinics. I think it covers like 98% of physicians in Iowa and 99% of hospitals. The HMO is a smaller network, which the premium is less on the HMO plans. But depending on where you're at in the state, an HMO plan might work well for you if all your doctors are, located locally. Here's just a quick overview of our dental plan, which if you had watched our webinars last year, nothing is changing on this plan wise. I won't go through all the details, but that's kind of a snapshot of the deductible, the preventative care, the percentages of, basic, major, restorative, the annual max benefit of $1,500. The premiums you can see there down below, they're per person in your family. So anybody who's over age 19 would get charged $35.94 a month. Age 19 under is $24.75. And we can send you these snapshots if you're interested in adding this to to your offering as well. Next is the vision plan. Just another snapshot of that. A nice offering for your employees if they wear glasses or just even want, I guess, something to go in and get an exam every year. I know these programs are really nice if someone is, wearing glasses and has to switch out their frames and things like that. The cost of the premium makes up for. It definitely makes sense for the benefits that you're getting. You can see the pricing down at the bottom of this one is more of a tiered structure. So if you're an employee only, you get $6.69. And if you follow it down, if you're just an employee and a spouse, $12.71. Employee plus child, $13.38. Families are $19.67. We can also send it to you too if you're interested in offering this to your employees. One thing I want to mention with the dental and vision, and then we're jumping here into the new lines of coverage that we're offering through the association this year through Unum, is that the dental, vision, and then the rest of these coverages I'm going to walk through are all voluntary. So what that means is you're not required as the employer to contribute any of their premium, contribute dollars towards their monthly premium. You could simply charge the employee 100% for these coverages, and then you just need to take it off their payroll, or however you collect that from the employee. So another benefit that we added this year is this voluntary life and accidental death and dismemberment program. What this is term life insurance for your employees, and the employees can also buy through this program for their spouse or children. So the guaranteed issue for an employee is up to $40,000 of life insurance, and what that means is they don't need to fill out any type of health, risk assessment form or evidence of insurability up to that 40,000. Beyond that, they would have to fill out a form. Then the guaranteed issue for a spouse and child is 15,000 and 10,000. The benefit maximum for the employee is either 5 times their annual earnings or up to 500,000. There's benefit maximum to the spouse and child there. And then if someone is older and still working and enrolls in this program, there is an age reduction, a benefit reduction by 65% at age 65 and 50% at age 70. These premiums are all age banded, so we would need to send you kind of the age table to calculate what it would cost per employee based on how much they want to buy, and we can easily do that for you as well. The next coverage we're offering is a voluntary short-term disability policy. Short-term disability is coverage that would supplement an employee's earnings when, say, if they would get hurt or get sick and unable to work outside of, obviously not getting hurt or sick at work. This would just be outside of work. So this would help their income while they're not able to work. The benefit is they get 60% of their weekly earnings, and that weekly minimum benefit is $25. The maximum is $1,000 a week. Waiting period on this, kind of like a deductible in a sense, is if you were to get injured, the next day that you couldn't work, you would start to get this benefit. If you have an illness, though, you'd have to wait 7 days before you could start collecting this benefit. So pretty much you'd have to be off 7 days in a row if you're on the illness side. The maximum benefit duration is 13 weeks. That's how long they will pay out. And then the pre-existing condition limit, that pretty much means if you have something, if you get sick or injured 3 months before this policy started, then you would be uneligible to receive benefits for the next 12 months. That's pretty typical on every short-term disability policy. Premiums, they are age banded here as well. We can get you that rate table for you to run the rates for your employees if they're interested in this coverage. The last two coverages are the voluntary accident and critical illness. Voluntary accident and accident insurance helps pay for medical and out-of-pocket costs that you may incur after an accidental injury. Um, this includes emergency treatment, hospital stays, and medical exams. What this specifically is kind of designed for is, if a lot of these plans we're offering, a lot of plans in the marketplace that are offered right now are higher deductible plans. You're not seeing like those $500 deductibles, $1,000 deductibles anymore. So this was kind of created as a benefit to say, hey, if one of your kids, or if you yourself, like, let's just say, breaks your foot. I use as example all the time. My fiance broke her foot, and she had a um, accident policy, and you just get like a lump sum payout depending on the type of injury. And I think she might have got like a payout of $1,500 to go towards her deductible at her health insurance when she was going into the doctor for her checkups, and if she needed to have surgery and things like that. So it can be a nice benefit to kind of offset your risk of that deductible. It's not a need for everyone. I know it's popular with people with families. So that's a benefit you can offer to your employees. There's the rates there. It's a tiered structure. And then voluntary critical illness. This is a policy that gives you a lump sum cash benefits to cover expenses associated with qualifying serious illness. So what that is specifically more of like a heart attack, stroke, cancer. If you were to come down, there's more coverage than that, but those are kind of the highlighted examples of, if you were to come down with those type of illnesses, then you would get a lump sum, and it might cover like transportation costs and other things. And again, towards your deductible on your health plan, if you have more of a higher deductible. Those premiums are age banded, so we could get you the rate table for that, to kind of show your employees. These are kind of more, you guys probably familiarize these with like an AFLAC policy. So we just have this as more of a group policy through Unum. Again, that's the last of the voluntary coverages. Just as a reminder, they all can be passed through the employee at 100%, and you at least through the association, which is nice. If you're a small employer, maybe you have a hard time getting access to all these coverages to offer. Here, the association, we're offering it as a big group, so it allows you to maybe get better pricing and at least have the opportunity to offer this to your employees, and if they want to take it, they can. Just a few Kunkel and Associates value adds. The health program is exclusive to Kunkel and Associates, and all these lines of coverage. So if you were to work with us as your broker, here's some additional services that you guys would get access to. We have access to this HR 360 portal. It's a portal that we give you free access to, and it has all types of state, federal benefits, compliance, HR, maybe it's hiring and firing, type techniques, and to salary benchmarking. It's an overall kind of HR encyclopedia that you get access to. Kunkel Connection Employee Communications. What those are is we send out like a monthly Kunkel Connection flyer that goes over some of the ways we can help educate employees how to be better consumers of healthcare and how to navigate the healthcare complex marketplace. For example, like, we might have a piece out on, hey, when to run into urgent, when to wait to run into urgent care versus running into the ER, because, especially with some of these higher deductible plans, if you don't have an ER copay, it could be expensive. So just what situations to wait, and wait till the morning to go to urgent care, things like that. We do have a dedicated customer service representative that I covered in the beginning with Erin. She would be that person. And then employee open enrollment meetings. Depending on your size of employer, we can do certain type of things to educate the employees on the plans and those details for each of the plans. And whether that be kind of like a recording webinar or a live webinar like this, at certain sizes, we can get out and get in person. Quarterly benefits compliance newsletters, another service that we are offering. We send a newsletter out quarterly that talks about current changes in the marketplace due to benefits and compliance, that what you as the employer would need to know. So just walking through some positive advantages to consider in looking at really the healthcare side of this program, and as well as the other lines, but specifically the healthcare program was designed so we can help stabilize costs and simplify administrative burdens and help employees better understand and utilize their benefits. Really, what we're trying to do here, and now we're in year two of building this program, is we're trying to band a bunch of small employers together under the association. So once we would grow to have, you know, over 50 to over 100 employees amongst multiple employers, now we can start to actually get large group pricing. Right now, a lot of you are in the small group market, where you're just being thrown in this pool with all small employers with each whatever carrier you're with, and um, those pools have traditionally been going up in price and down in benefit. So what we're trying to do here is, create ourselves our own large company, like a company out there of 100 employees. They're getting rated on just how those 100 employees' claims perform every year, and that's why they have more options as a large employer for plan design, and it smooths out the renewals better. So that's what we're trying to do here, is build up that program to smooth out future renewals so we can get more competitive pricing in that traditional small group ACA market. So really we're trying to promote that collaborative approach to give employers the ability to impact the long-term strategy on healthcare. We want to make these plan designs simple, again, so employees can better understand and use their benefits. What's nice is these plans can be adjusted year over year by the Home Builders Association. Wellmark does not tell us what plans we have to offer. We work and consult with the state association to develop the plans. So anytime we can get employer feedback of people that are in the program or want to get in and want to influence the decisions on impacting the program, we're all ears for that. Um, and really just having that exclusive access to those plan designs that are not offered on the ACA market is a perk of this program. Timeline wise, you have till December 1st to get quotes on these programs, and we would need to know by December 1st if you as the employer are moving your group health plan to the association's plan and offering that coverage to your employees. So any groups that decide, between now and December 1st, that they want to offer this to their employees, between November 15th and December 15th. That would be the actual employee open enrollment, where the employees would elect what plan, if you're offering maybe a couple plans, or offer what plan that they're going to take from you, and if they're going to add their spouse, dependents, things like that. That employee paperwork, that's going to happen between the 15th of November and December 15th, and then it's a January 1st effective date. Next steps, if you're interested, um, please contact me. I'll have my contact info on the next page, which many of you might have already got it from your local associations. But what I would be requesting from you is just a census, with your employee information and their spouse and dependent information if they're wanting coverage, and just like kind of your employer info too. It's pretty simple. I can send that to you. If you get that back to me, we can generally get a quote turned around in 48 hours. If you do have a current group health plan today, um, I would suggest sending your current plan design and current rates. In our world, we all have access to all the carriers anyways, and if I can help do a comparison on the cost illustration of the home builders plans versus your current, I can help show that pricing really simply for you. And what I suggest too for anybody is, even before I have a census template that I would send you to send back to me, but if you even want to just contact me and have a phone conversation about your current situation, and what carrier you're with, I understand the market. So just to keep my time efficient and yours, we can talk about what, the plan design maybe you offer today, and I can kind of consult with you and see if it makes sense for you to pursue this or not, and kind of, gets down to the nuts and bolts before we would do any work. So I do suggest everybody doing that in some form over email, or reaching out to me by phone. Here's my contact info. Go ahead and jot it down if you need to. I appreciate you guys listening in today. I'm going to see if there's any questions here quick. All right. I am not seeing any questions. Again, appreciate you all of you coming out today and learning more about the benefits through the Home Builders Association. Hope to hear from you all soon, and have a good rest of your day. Thank you so much.